kasi to, start at the middle, pag kunwari, meron sa inyo na may konting background with credentialing, and then the rest doesn't have. So, ayun. So, my name is Cyrene. So, you can call me Sai. So, ako yung team lead sa guided care. So, I handle offshore folks. So mga Pinoy yung hinahandle ko. But we also have, I think one na taga Mexico ata yun. So basically we are all, yung mga Pinoy dito, there's one na under agency, and then the rest, the three are direct hires. And ako din. So I'm a direct hire too. So I've been with guided care for as long as I remember. So there's I don't really remember like how long I've been with them. I think around 3 years na ata. So medyo matagal na. It all started during the pandemic. So and then I handle the training, I handle everything like the onboarding. So it's the first time na we'll be having partners when it comes to, hiring people, mga ganon. Kasi nga, we had, ano kasi, parang they don't really like hiring through an agency before. I don't know kasi siguro sa logistics na din. But yun nga, I'm really excited to uh, do the training and have this streamlined kasi there's really a lot going on right now. We have a lot of work to do. So yung training kasi is one thing that really takes up of my time. So I really hope na this can be straightened out, and we'll be able to work together on how we'll move forward with all these trainings and stuff. So ayun, so that's me. So Kim, yeah, you with your team na lang. Who's gonna start?
Yeah, maybe I can start. So I'm an account manager here in ISTA. So guided care will be one of the accounts that I'll be handling, and I'm looking forward to with this team and hopefully to grow. Right now with credentialing team we have three functions. Sorry, with the guided care we have three functions. The clinical team, the pending odds, and then the credentialing. We are done or completed with the training for the first two functions, and then now here with you, Serene, I'm hoping that the team will learn a lot from you, and I'm hoping that they
Maui,
can meet the basic
lagyan mo na ng
expectation of what
wax.
you're looking for. Actually, with that, that's all about me. I want to call on the next person, probably the TL of guided care, Jerry San Juan.
Yeah, hi. My name is Geraldine Sanwani. You can call me Jerry. I
Ano?
was a provider
Second nagko-cover
coordinator
eh.
with a different hospital from the US before joining guided care, and I'm so excited to learn more and hope to meet the expectations.
Nag-ano ba?
So
Namula ba,
next will
Audrey?
be Sherwin.
Namula ba
Hi.
yung mga ano
Hi.
nyo?
My name is Sherwin, and
Yung
you
mga
can call me Chef for
ano
short.
nila?
And I've been in the BPO industry for 4 years, mostly handling a member services for prescription drug plan. So yeah, that would be all. Thank you.
Jonathan, you can go next.
Hi, my name is Jonathan, and I've been doing credentialing for quite a while. The largest client that I handled was Sound Physician. I guess that's the largest that I handled. Been with credentialing for about 4 years already, and I look forward for new knowledge in guided care.
All right, that's all for the guided care team. But we have here our support from ISTA. Johan, the training manager. Johan.
Hi, Serene. Hi, everyone. My name is
We
Johan
cannot hear you,
Strebel.
Johan.
Sorry.
Yeah.
Take two. Okay. Hi, everyone. My name is Johan Strebel. I'm the Assistant Training Manager from Operational Excellence. Currently, I will be covering for one of my trainers, which is Kurt, who is assigned to work with you directly, Serene, in terms of documenting the training and assisting the agents here on site in ESTA while we're doing the training itself. Nice to virtually meet you. Next,
Thank you,
I
Hi,
Johan.
Shola.
Serene. I'll go next. So I'm Shula. I'm the client success manager. I'm actually working in the US. I'm here to support your team in any way I can. So please reach out if you have any issues, questions, feedback. I would love to hear from you.
Thank you.
So I guess it's my turn. Hi, Serene. My name is Mark. I think we met during lunch. So I'm the director for
Uh,
OPEX, and I'm here to support you guys. Thanks.
okay. So yeah, thanks everyone. So basically I have Sherwin, Jonathan, and then Jerry, and then Kim. Um and then Mark, possibly, that I'll be working with all throughout the project, right? So okay, I'm just putting this here. So Jerry is the team lead. Okay. Perfect. So I heard Jonathan. So Jonathan has the credentialing experience. That's great. So basically,
Nika, hindi na
so
mula
the
yung
training
kahapon
will
mo.
start with some basic
Nika,
knowledge about credentialing.
hindi na
So
mula yung
that's going to be
kahapon
the
mo.
first day, and then I'm just putting
Yung sa'yo,
into some
Van.
documents and
Hindi na mula yung kahapon
exercises
at
that
saka
we can
ngayon.
do, especially those without credentialing experience. Jonathan, may I ask, do you have experience with skilled nursing facility credentialing?
Um, no, just nurse practitioners and
Nurse,
anesthesiologists,
okay. Okay, medical and behavioral?
medical doctors. Yes.
Medical, okay. All right. Thank you. So that will come in handy. I'm just gonna note it here because there's really a lot of work right now with guided, so we really need support. So thank you so much for coming in. Um, all right. So and before we formally start the training, so you mentioned Kim earlier that the RDP is not yet set up. Is that right? Is it still the case?
Yep. We have escalated it to your IT, so we're still waiting for response.
Okay. Yeah. Hopefully they'll be able to set it
Did
up
everyone
today,
try
but
logging out? Did everyone try logging out and logging back in? Because I know that someone from your team worked on it late yesterday, so it's possible that it's fixed now.
actually if you already have like the logins and all that, can you have your team try again because it won't open until I think 8:30 EST until 9, like they are having issues if you work before your shift or after your shift.
Yeah, I believe I
So
was
if you
able
can try
to
today.
set up the RDP yesterday.
Right, but then there was no, I think
Can
there
you
was
try
no
again?
like AVD assigned. Can you try again and maybe share your screen? Let's see if it goes through.
All right, sure. One moment.
Are you all on site? Or there are people working from home too?
Yeah, we
We
are
are
on
all
site.
All on site? Oh, okay.
Mm, Still just connecting. One moment. Okay, there you go. So here's my RDP screen. If you can see.
Yep. Okay. Oh, okay.
Oh, sorry, accepted.
Okay. Yeah, I think that's good for now. So at least you're able to log in. Okay. So just let me know if the others have this as well, if they can go in. So for now, we'll start the training first, and then I'll show you the RDP setup later. God, my dog is like trying to come out. Okay, so I will share my screen here. Can you see my screen?
Yes,
Yes.
yes, we can.
All right. So this is our training manual for guided care. So as I mentioned during the launch yesterday, so there's whenever we do training, there's just like one or two people, who attends the training, and then we have like a personal attack on it, meaning that it will depend on the experience of the person that I'm training. So, like for example, last month I had a new trainee, and that trainee only has knowledge about prior authorization. So basically, she doesn't have any other backgrounds about credentialing. She doesn't know anything about credentialing. So we started from scratch on there, but we don't really have a training manual because we just really do it based on what work you will be assigned to. So right now we are trying to create a streamlined process of the training manual focusing on skilled nursing facility, since most of the credentialing applications here are for skilled nursing facility, and the tasks will be determined by the contractors who will be assigned to your team. So as of the moment, I am not sure who will be assigned, because as far as I know, there will be a lot of new facilities coming in, which is good. And the current number of VAs that we have cannot really handle that much of the workload. So we will be focusing on skilled nursing facility credentialing for all throughout the training. If maybe if we have like time, we can do like some um I don't know, like some introduction to other credentialing, because the credentialing world is kind of it's a very big world. If you may think that you know everything about credentialing, if you have several years of experience, but then you'll encounter uh, new learnings, new things along the way, because credentialing varies from states, from provider types. So there's really a lot going on. So if we will be discussing everything, it's going to take a while. So Um, so here, so we have the skilled nursing facility credentialing training manual. I will be sending this to you, Kim, as well, so that the team can take a look at it and they can use this as their reference as they go through their credentialing journey and support with guided care. So there's this contents that we will be discussing for today. So basically, we have like just 6 items for today. So we'll start with some introduction about this manual, importance of credentialing. Then we'll try to understand credentialing, credentialing versus contracting, credentialing process overview, required documentation, and then the common errors and how to prevent them. So, all throughout
Magkano daw isang
this
balot nito?
training, I will be showing you the things that you can
Magkano
see in
daw
our
isang
DP,
balot?
in our remote desktop, and then
Hindi.
the
Ay,
systems
di ko
that
pala natanong
we are
tanong ko sa
using
FPH.
because for today you'll most likely start with some navigation exercises if your RDP is already working, and then we'll go from there. So by tomorrow, I'll be uh, sending you like a different, different topics, and most likely we'll go through like the nitty grit, details of what we are doing here in guided care and what you'll expect to handle. So there. So any questions before we formally start?
None.
None. Okay. And if you have any questions, by the way, you can go ahead and just ask anything. So we can focus, on the question while we're on the certain topic. Okay. So introduction. So here. So basically this manual will just guide you through the basic, just I'm saying basic because this is so this is just really like the basic instructions and guidelines on the process of skilled nursing facilities. So of course after this training, um,
Thank you.
the reality will kick
Pero
in, and
hindi
that's
pa
the
siya
only
ano,
time that you will
protein
be
pa
able
siya.
to ask so many questions
Oh,
regarding certain
bumili ako
applications,
ng
certain
dalawang bag.
tasks that your contractors will ask you to
Hindi.
do. So but since we are starting off with this basic knowledge, this will really help you out on determining what skilled nursing facility is, and how it is different from other credentialing, individual credentialing. So, anyone here who's familiar with a skilled nursing facility? Like, have you heard
Ah,
what a skilled nursing facility is? Like, Jonathan, have you heard of a skilled nursing facility?
Yes.
So, what is a skilled nursing facility on your, based on your understanding?
It is a facility that has basically their what I call this their specialties are taking care of patients that are needed to
daming check
be
mo tato.
or needed to be guided by a nurse or a
Mhm.
what do you call this a therapy like that, something like that.
Mhm. Correct. So, yeah, thank you. So, that's right. So, for skilled nursing facilities, so in the US, right, so they have several facilities there. So, they have hospice, they have skilled nursing facilities. So, these facilities offer long term care for patients, especially those with chronic conditions. So, there are skilled nursing facilities wherein they get patients who are old, and those patients who need medical attention, and these patients cannot just be at home and have like a personal nurse or something that can look after their condition. So those are the skilled that's the skilled nursing facility. So based on the term, it's a facility. It's not a group practice. It's not it's not a hospice. It's basically like a hospital, but it's not a hospital who takes care of emergent conditions. Like they just come in into an emergency room, and then they have doctors who will be taking care of them. So with skilled nursing facilities, these are mostly those with chronic conditions, and they need long-term care. There are also skilled nursing facilities who offer short-term care. It would depend on the services that they offer. But basically, this is a task of nurses. So there are skilled nurses who are employed on skilled nursing facilities. However, there are also doctors in skilled nursing facilities because doctors are required, especially on emergent conditions. But mostly, the nurses are the one who's taking care of those patients in here. But we are not credentialing the nurses. Okay, we are credentialing the skilled nursing facility itself. So that's why we are handling facility credentialing and not individual credentialing. So Jonathan had an experience with credentialing, mostly with medical practitioners, nurse practitioners, um, and doctors. So that involves individual credentialing and also group practice credentialing if they are linked with a group. So, but for now, we'll focus on SNF. So the purpose of this manual is, of course, to learn about the credentialing process and how it helps a facility, and then, of course, understand your role and responsibilities, and then to ensure that the facilities remain compliant with the laws and regulations. Um, why is credentialing important for skilled nursing facilities? So here, you'll see that with credentialing, it's basically a process of verifying that a skilled nursing facility meets all the necessary standards to operate legally and safely. So the reason why it's important is, of course, number one, to comply with the laws and regulations. So with credentialing, it ensures that your facility follows state and federal laws. So that includes Medicare, Medicaid, and then other private insurance companies. So whatever the skilled nursing facility offers. So not all the time, that you'll have to handle all payers or all MCOs. So MCO is a managed care organization. So those are the terms that we use for credentialing to identify the insurance company. So you can mention them as payers. You can also mention them as MCO. So with guided care, we usually use MCO to determine the insurance company that the contractor wants you to work on. So without proper credentialing, your facility could lose the ability to participate in these essential programs. Um, so later on, I'll be showing you some of the websites that we use, and that includes the Medicare compliance website, wherein we can check some facilities in there that's in compliance with Medicare. And then we also have accreditation and quality care. So here, if your facility is credentialed, it will only show that you meet the high standards of care and safety. So, of course, when you pass the credentialing process, especially for skilled nursing facility, um, someone's joining. So, especially for a skilled nursing facility, there are certain documentation, site visits from Medicare that's needed before you can pass the credentialing. So, before you can really operate. So, that's why it is very important that this is passed, and all your documentations are good and compliant, so that you'll be able to pass credentialing. So this not only helps you to stay compliant, but it also proves to the patients, the families, and regulators that you provide quality services. And then we also have eligibility for insurance programs. So, credentialing is required for your facility to participate in key programs like Medicare and Medicaid. So, these programs provide funding for the care of many residents. And without credentialing, your facility may not be eligible for this important program. So, what does this mean? So, to compare it with what we have here in the Philippines, so we have HMOs, right? I don't know if you have HMO with ASTA, but with HMO, there are several hospitals who accepts HMOs. And if you have an emergency or if you need to be hospitalized, usually you use your HMO so that you won't pay for any services, right? So the hospitals are undergoing credentialing as well with this, insurance companies. So this is in order for them to be in network in this, in this insurance companies, and that they'll be able to accept patients from that insurance, so that when a patient comes in, then the patient won't have to pay for anything, or if they have like any responsibility or out of pocket, then that's the only amount that they'll be paying. So same with a skilled nursing facility, they need, or in order for the patients to use their insurance cards to this skilled nursing facilities, they have to be credentialed, and they have to ensure that they are in compliance with everything so that they can be credentialed, and those patients won't have to do out of pocket charges. So so Jonathan, just to ask, so to share your experience, what's your experience when your provider is not credentialed yet, the individual provider is not credentialed in a certain MCO?
The patient actually will not be able to, or the provider will not be able to service the patient, since the insurance of the patient will not going to pay the provider. So it's either the patient will have to pay out of pocket for the doctor for that kind of service, or the doctor needs to be credentialed to that insurance for the insurance to pay for that service.
Mhm. Correct. So it's horrible for the patient to suffer because the provider is not credentialed, so because if since you most of you don't have experience with credentialing, there are instances wherein the providers provide services even if they are not yet credentialed, and then uh, people or the billing department will hold claims, and then credentialing will do their job to try to credential these providers and ask for retro dates, ask for authorizations, or anything that can make can have that service payable. But it is not a guarantee. So that is why we are doing credentialing first before these providers do the services, and that goes with the skilled nursing facilities as well. So before we admit patients with this insurance companies, we have to make sure that our credentialing is good to go for this plans, for these insurances, because it's going to be a burden if this process is not done first. So that's why credentialing is part of the front end process of the revenue cycle management. It is a process along with the prior authorization, eligibility, and then credentialing. So those are the ones on the front end process, because this needs to be completed first before you can render services to the patient. So that's why one importance of it would be eligibility for insurance programs. And if you don't have any credentialed insurances, for example, you're not credentialed to any insurances, the only option that you'll have would be for out of pocket services. And of course, it's a skilled nursing facility. Most likely, it will not cost. It's costly. to be in an SNF facility. So that's why people, especially with Medicaid, they use their Medicaid in order for them to go and be admitted to a skilled nursing facility. So
Johanna Marielle Tipwans is currently unavailable.
meaning this, patient um, continuity of care to these patients. Okay. And then the next one would be protecting the facility and the residents. So it makes sure that your facility and its staff have the right qualifications, reducing the risk of legal issues and ensuring the safety of residents. So of course, with skilled nursing facility, as mentioned, there are different providers inside the skilled nursing facilities. So in order for for example, the patients to be protected, the insurance companies are making sure that the facilities are in compliance with everything before they can take in patients. So one thing that is being looked into, which we will be checking later, would be the compliance that they have with Medicare. So with Medicare, they have like this site visit. um I don't know if you are familiar with a site visit. So basically what happens there is um a representative from Medicare or from insurance company goes into the skilled nursing facility, and then they check if the facility meets the standards. So what are the standards? So like for example, the number of beds that you have, the number of nurses that you have based off the number of patients that you'll be admitting. And then there are also instances wherein they check the conditions of the patients, especially if it's a facility that's already up and running. They are checking every single patient into the facility, and they are ensuring that these patients are treated with care. Because I don't know if you have heard some of the SNF before, wherein there are news that there's abuse from the facility, from the practitioners when it comes to their patients. So that is something that they are trying to refrain from happening. That's why there are site visits for ensuring compliance with the facility. It also protects the facility because they have to make sure that, of course, the staff that they are hiring have the right qualifications. Because if the staff has the right qualifications, then they'll be able to render quality care to the residents, and then the rest will you know it will come forward. So that's one importance of the credentialing for skilled nursing facility. And then we also have building trust with families. So of course, with credentialing, it helps build trust with residents and their families by showing that your facility is properly certified and meets high standards of care. So if you look at this this importance of skilled nursing facility, it always uh, uh, boils down with the quality that the skilled nursing facility is offering, as well as the standards that the skilled nursing facility should meet before they can take in patients. And of course, at the same time, it also gives protection and ensuring that the patients who are being admitted at a skilled nursing facility are treated with proper care and respect. And that's mostly why credentialing is very important with skilled nursing facility. So aside from the fact that, of course, they can take in patients, they are gonna get money. They can give this to the insurances and the insurances will pay. Aside from those, it gives a sense of relief as well on the patient and also on the side of the providers inside the skilled nursing facility. So I just want you all to understand how vital your role is with credentialing, because sometimes it gets overwhelming, and then sometimes you're like, why am I doing this? It's like there's a lot of work coming in my end. So I just want you to go back to why it is important, and that you are helping a lot of people by just doing this front end process of the revenue cycle management. So, any questions on this importance before I move forward, or anything that you want to share on your end?
None for me.
Then so far
None
for me.
for me.
Okay. So, next is how credentialing fits into the big picture. So, for credentialing, it's not just a one-time task. Jonathan would would know about this. It's not a one-time task, so it's not like uh, when you give out the application, when you send the application, that's the end of it. No. So credentialing has a lot of process. Um, what we are lucky because with guided care we are only doing I think like um, the second and third process. So with credentialing we have number one, we have onboarding. Well, actually we do some onboarding as well if your contractor allows you to. Onboarding is you are going to get all necessary documents from your provider. It's like, when you are hired in a company. So when, for example, when you were hired with ISTA, so when you were hired with ISTA, ISTA most likely asked for some documents to prove that you are um, someone legit. That you are using your real name, that you are this age, that you have this amount of experience. Um, they will do that. They will ask documents to prove your identity. Same with credentialing. So with onboarding, we are asking several documents to our providers so that they can give us this proof that they are eligible to be credentialed. So later on, I will be giving you the list of documents that we are attaching on a single application form for all skilled nursing facilities, and it would be part of your task as well, to ensure that all of these documents are, you know, attached and are in and that you're attaching it based on the order that it needs to be attached. So that's onboarding. So with guided care, we have several skilled nursing facilities, and since our contact with guided care is normally directed to our own contractor, so we have a contractor which is they are based in the US as well. So these contractors, they give us tasks, and the task could include a new skilled nursing facility. That's why you have to ensure that you are getting the documents needed before you can even start credentialing, because you cannot submit any applications if your documents aren't complete. So that's one thing. That's the first part of credentialing. Second part would be the application submission. So once you're good with all the documents, you know which are the payers or the MCOs that this provider wants to be credentialed with, you go with the application submission. So your contractors will send you tasks and attach the application forms on those tasks. And then they will ask you to, hey, please complete this application for these facilities. So they will give you exact instructions on which are the facilities that you need to do the application forms. So that's the second part. So you, as a credentialer, you will be filling out the forms. You'll be getting the information from our database, which I will be showing later as well, and then ensure that everything on the application form is correct, complete, and current. So that's the second part. The third part would be the follow up. So when you submit the application form, you will not stop there. You have to go and follow up on those application forms, whether it was received, whether it was rejected, whatever status is it. So the follow up tasks will come from your contractors as well. So you're not the one who's gonna like do a Google Calendar or a calendar invite that okay, so I have to follow up on this date, blah blah blah. Um, that is the contractor's responsibility. So the contractor will send you another task, most likely around like after 2 weeks of you sending the application form. Sometimes there are contractors wherein they follow up with you after 1 month. So um, they'll send you a follow up task. They will just say, hey, can you please call this MCO and ask if they received our application, or what's the status of the application. So that's the third part of credentialing. So onboarding, application
Iyo,
submission, and then we
tignan mo
have
yung
the
GC.
follow up. And then after the follow up, we have um, we have the recredentialing. Sick leave. So we have the recredentialing. So so once you do the follow up, you'll know if the provider is already credentialed. So if it's credentialed, then it's good. I mean, the provider is now eligible, or the skilled nursing facility is now eligible to get patients with that insurance or with that MCO. But it doesn't stop there because there is recredentialing. So, recredentialing means that there's a certain time period for the provider's credentialing effectivity. So usually it's around 3 years, 2 years, 3 years, and you have to recredential the providers or the skilled nursing facility again, in order for them to continue care with that MCO. So that's why it's not just, a one-time task. There's also other things that adds up to the tasks, or on the processes, the four processes that I mentioned, because there are instances wherein there's also the demographic update, which is, they're just updating their NPI, they're just updating any addresses or location for that certain skilled nursing facility. So there's a lot of things going on with credentialing. And that's why
Pwede, pero
it's
dun ka
very
naman
important that,
mag-duty ng
if
Friday, di
you,
ba?
like, for example, Kim on your team,
Tingnan mo yung
and
OPEX
Jerry, like,
trainers sa
if
GC.
they want to, like, get some terms, because I don't know if that is something that your team has already done, or like an overview for them on the credentialing terms, on the ones I'm mentioning. Please let me know if it's needed, that if you need like this documents, so that I can try to put up some documents about it, and then I can send it to you, because there's just a lot going on with credentialing that we cannot really fit in so much training, and it's just really limited, because we also have a lot going on our end right now. So yeah, so just let me know, and then so I can prepare some of it, and then we can discuss what other help is needed. Like if you have like any confusion, like any things that you want to clarify, or if you want me to like document what I'm saying right now, like the 4 steps and things like that, just let me know. Okay. So you can just ping me, Kim or Jerry, send me an email so that I can prepare it in case so your team could have those references. All right.
Thank you so much. Yes, definitely we will. In it.
Okay. So it's an ongoing process that helps ensure the facility is compliant and providing top quality care. And then, so as I mentioned earlier, so if the skilled nursing facility is credentialed, then we'll have access to reimbursement, better reputation, reduced risk of legal issues, and then we have improved operations. So if we keep up with the credentialing process, then our facility will be in a strong position to deliver high quality care and also meet the legal and regulatory requirements. So, any questions on this before I proceed?
None for
And
me.
then
None
So,
for
just
me.
let me know if it's kind of an overload. We're just on number two, but so here. So number two, we are to understand credentialing. So um I had like I had a client before, and I was informed that on their end it's not really a credentialing specialist role, because they said that a credentialing specialist is like the person who's doing the credentialing, they call that verifying the credentials of the provider, and our role is like more of provider enrollment. So meaning we are enrolling the providers into certain MCOs or insurances so that they can do the services and accept patients. But technically, credentialing is a process that that they verify credentials. So that's why it's credentialing. So they verify the credentials based on the submitted documents, and then they see if those documents submitted are within the standards. If it's, for example, if it's not expired, if it's current, if it's obtained legally. So because as you know, here we have like we have options to get the documents illegally. So of course in the US they also have that. So that's why it's credentialing, is credentialing because they are verifying the credentials of each providers and making sure that these providers are within the standards and regulations. So they have certain um, commissions, and also certain departments that verify credentials. And I'll show you some examples later of the commissions that um, verify if these providers are um, obtained their licenses legally, or if what they are putting on their resumes are correct. So that's why we are mostly working on provider enrollment and not really credentialing, because it's the insurance itself that's taking care of that. But it's just I don't know, like it's just a term that's mostly used, like a credentialing specialist. But mostly what we do is we do provider enrollment. We are enrolling our providers in this number of payers that we have. Okay, so don't be confused with that, with the terminologies of being a credentialer versus a provider enrollment. They are basically the same, especially if you just go into the technicality. But basically, we are also doing the provider enrollment. Okay, so what credentialing is? So credentialing is here, it's the process of verifying that the facility meets all legal, regulatory, and accreditation requirements to operate and provide care. So it includes ensuring that the facility is properly licensed, follows necessary standards, and then meets compliance regulations set by authority. So with credentialing, specifically for a facility, this includes the facility licenses. So is the facility legally authorized to operate in the state and meet the required standards? Certifications. So does the facility hold the necessary certifications from regulatory bodies like CMS and other accrediting organizations? And then also compliance. So does the facility follow all required federal, state, and payer-specific regulations and guidelines? So that's why I said that we are mostly on the provider enrollment side because with credentialing, this is what they do, and we don't really do this. Like we're not the ones verifying if they are legally authorized to operate. We don't do that. We just check if the facility license is current. Like, is it not expired? When it comes to certification, same thing. We are just checking if the certification is still current. With compliance, we don't really like check this, but we just have to ensure that we have the compliance document from CMS so that we can confirm that the facility is in compliance. So when we get all these documents and information from the facility, then we can go ahead and submit this applications. That's why in technicality they are kind of the same, because your role is also to make sure that all the necessary documents that you have are current before you send them to the MCOs. Because if you send them to the MCOs, their credentialers there, who verifies credentials, they will just return those to you, and they will tell you that this facility doesn't have an active license. Why are they operating? Do you have an updated license? Things like that. So it's part of our role to ensure that all of these documents are current. Okay. And then, so here, facility credentialing, this is what I've mentioned earlier. So we have individual credentialing, and then we also have facility credentialing, and we are only focusing on facility credentialing. So Jonathan would know the difference of facility credentialing and individual provider credentialing or group practice credentialing. Once he's able to practice the application forms that we use here. For me, I think facility credentialing is more complicated than individual credentialing, um, only because since you are only dealing with an individual or a group practice, mostly the requirements for individual credentialing are lesser than the facility credentialing. Because for facilities, in order for you to open a skilled nursing facility or a hospital, you have to like get bunch of documents. You have to get certification licenses for um, the area itself, in order for you to get credentialed, and in order for you to get contracts. So unlike for individual credentialing, they and also for group practice, as long
25
as you
huling
have
pumasok si Mary, di ba?
like a practice location, whether it's like a telehealth location or it's a dummy location, you can go ahead with individual and group practice credentialing, as long as you select um, the correct provider type, the correct location, especially if it's telehealth. It's not really very crucial for them to have certifications for the location. But for facility, the locations need to be certified in order for you to submit uh, any credentialing documents. So that's just the importance of it. I'm not gonna go through this because it's like basically the same. So So here, so how facility credentialing works. So um, there are several key steps for facility credentialing. So as I mentioned earlier, we have the onboarding, application submission, we have the follow-ups, and then we have the re-credentialing. So here it's just basically it's just different terms, but it's the same. So we have the application submission. So we will be submitting applications, document verification. This is from the credentialer side, from the insurance side already, wherein they verify the facilities documents. So on our end, this equates to onboarding, which is the very first step. But for the credentialer, once they receive it on their insurance company, then they will be verifying these documents submitted, if they are current, if they are on the website, if they are legal documents, so things like that. And then there is the review and decision. So once the documents are received, the credentialing body or whoever is approving the credentialing, they will make a decision whether the facility meets the standards. And then if it's approved, then the facility is granted, the credentialing status and can participate in the programs that you have applied them for. So it's not necessarily just Medicare and Medicaid. It could be commercial insurances as well, like Aetna, Cigna, um, Wellcare, Ambetter. So it would depend as well on the states. If the state has this certain MCO or this certain insurance company. So the review and decision would be on their end, and if they need additional documents from us or additional information, they have other questions, then they'll be reaching out to us on it. So with guided care, the notifications are usually sent to our contractors. So that's why I said earlier that our work here in guided care is much simpler compared to if you are working end to end credentialing. Jonathan, did you do end to end credentialing?
Yes, I did.
So how's the experience there? Like, how is it? So that everyone would hear it from you. Like, how do you do things? Your role.
The workload is it depends on how many tasks or providers
Mm-hmm,
the clients provide. But usually, if it's gonna be if you provide few hundred providers, it's not that kind of overwhelming. But if the
mm-hmm,
client needs to credential a whole hospital or a whole provider in a specific hospital, then that's kind of overwhelming. And since there are a lot of providers that needs to be credentialed, and we're doing end to end from onboarding to follow up until completion, so
mm-hmm.
it's a lot of work for.
Yeah,
Uh,
correct. Do you also provide client updates?
no, the client updates are provided by our supervisor.
Okay, gotcha. Yeah, so with guided care, thanks Jonathan. So with guided care, it's much simpler. So you'll be given tasks only. So basically, these tasks contain, for example, please submit application for this MCO for this facility. That's it. And then you'll get another task. Please call Aetna, for example, and check if this provider is, already in network under this plan. Most of the time, they are very specific. Like they will tell you which plan, and they will tell you what you need to provide or ask the insurance company. So that's why it's much simpler. Um, Because if you're working end-to-end credentialing, and you also have, like the client updates, so you'll start from onboarding, you get all the necessary documents, and then you submit the applications, and then you do the follow-ups, and then you update them um, of the re-credentialing dates, and then you also do the provider portals. Sometimes you also set up EFTs and ERAs. Sometimes they also ask you for a group contract. There's a lot of things going on if you handle end-to-end credentialing. But here in guided care, you're guided. So there are just certain tasks that you need to do, and those are the tasks that moving forward, as we go along the training, you'll become more familiar with, because I will be sending you some tasks as well. And you'll be completing them on your own. And then if you have some questions, before you submit the applications to your contractor, I will be reviewing them first. And then, if, for example, Jerry, your team lead, is already well versed on the process, then she can also do the checking moving forward. But yeah, during the course of the training, what we usually do is I check everything that I give to you, like all the applications, all the phone calls. So I double check those, and then ensure that, the information that you gathered, the application form that you have filled, are accurate before we submit them to the contractors. So maybe Jerry and I can connect, if you are already on that phase, so that I can also teach Jerry on how, she can check and ensure that the forms and the phone calls are accurately completed. So, but yeah, you'll have all the support that you need. And I'm also confident, because Jonathan, you have Jonathan on the team too, who has credentialing experience. So at least on some of the terms, he'll be able to help you out as well. And then, yeah, we'll just make sure that you are equipped, especially with the navigation. Because for me, when I started, that's like the I think that's the worst for me, like the navigation itself. I had so much trouble with PDF, because they use PDF exchange here, and that's not what I was familiar with before. So I had a really hard time with the PDF exchange. So that's why whenever I do training, the very first that I give my trainees would be, aside from the navigation, is transferring of an application, a filled application form to a blank application form using the PDF exchange, because when I do it on the remote desktop, like it's so slow. And you know how a remote desktop works, it's really really slow. So and then I'm not familiar with that PDF exchange application. So I think I had like a week of just trying my best to familiarize with the PDF exchange file. So that's what we'll do in the next couple of days. And then we'll see how the improvement, and like what other help needed as we go along. So, and then the last would be the notification. So after the review, like if you're approved, then the facility will be sending, or sorry, not the facility, the insurance company will be sending a notification that we are approved. We have the welcome letter, we have the effective date of when the facility is credentialed, and they will also send us um, instructions. If, for example, there are additional documents needed, or if they need some changes on the application forms. So, um, doing credentialing, it's very important that you have the accuracy to submit the applications, because credentialing takes time. So credentialing usually take like minimum of 30 days for government, for Medicare usually, and then it could take up until 120 business days. So that's why accuracy on the forms are very important, because if they will return it to us um, with with corrections, that will somehow reset the time frame. So the timeline of credentialing, it will reset, and we don't like that. Our contractors don't like that. So that's why on the first few applications, or on most of the applications, I'll be reviewing it first before you send it to your contractors, because we have to ensure that the accuracy level is like 100%. Like they don't want the forms being returned, and also um, we have to ensure that what we are attaching, the documents we are attaching, are still current. So yeah, we'll go there when we have our application already. So, who oversees facility credentialing? So, here we have several regulatory agencies, CMS, state health departments. We have for example, in California, they have the California licensing. They have their Department of Health. So, there's a lot of regulatory agencies for facility credentialing. Unlike with individual credentialing, there's just a few needed. Accrediting bodies, so we have organizations like the Joint Commission and the CARF, provide accreditation
Mavi,
based on quality standards.
okay
So
na
this
yung ano,
depends on
yung kape.
if your facility is with with this accreditation. So they can be, sometimes they are in the Joint Commission, sometimes they are in CARF. So with the accreditation, it would depend on where your facility is accredited, but mostly it's the Joint Commission for facilities. So for individuals, they don't really need this accreditation. So they just need their licenses active, and other documents needed. And then we have the payer and insurance networks. So the insurance company may have their own credentialing requirements to ensure that a facility qualifies for participation in their networks. So as mentioned, the reason why we're not really going through state by state credentialing training is because there's a lot of states in the US, and there's a lot of insurance networks in the US, and it's not it will be very very time consuming if we will be discussing
Deo
all of the
Luisito Ramos
states
ba siya?
credentialing processes,
Mavi,
but
Deo
we'll
Luisito
be doing the
Ramos.
basic. And once you learn the basic of filling out an application and doing a follow-up, um, we will be able to at least guide you on the specifics. Like
Oh.
if you got a Ohio, for example, an Ohio credentialing application.
Oo, itan.
So if you receive an Ohio credentialing application, then I'll be able to assist you depending on the need. So instead of us, going through all of those states and all of those pairs. Okay. So any questions before we proceed?
None so far.
Good, good. Okay, good. So we have credentialing versus contracting. So I keep saying earlier about a group contract, about credentialing, but credentialing and contracting are different things.
Lima yun.
So we have here the differences of credentialing and contracting. So for us here in guided care, we only do credentialing. But I'm sure with Jonathan, your experience, did you do contracting as well?
I'm not very sure with contracting, but I believe no.
Oh, okay. Mostly credentialing. Okay.
Yes.
So with credentialing, so this is, the process of verifying the facility meets all standards, and all the qualifications to operate legally. So the credentialing ensures that the facility is qualified to provide care and participate in government and insurance programs. So as what I said, credentialing verifies credentials. So verifies credentials, and this is needed in order for the providers to be in network in a certain insurance company or in a certain plan. So that is credentialing. Contracting is different. So contracting, this is being handled by our contractors. So that's why they are called contractors. So they do the contracting portion. Contracting refers to the process of entering into the agreements between the facility and the insurance company, government programs, or other organizations. So these contracts determine payment rates, coverage terms, and services provided by the facility under certain insurance program or networks. So contracting happens after credentialing is complete and allows the facility to participate in reimbursement programs. So this is not always the case. All right, contracting happens after credentialing. No, it's not always the case. Most of the time, they happen. Contracting happens um, first, like it happens first because we'll be given an effective date, and then after that, that's the time that we can add our providers into the network and into the contract that um, the facility has or the group has. So it's not always that it happens after credentialing. There are instances that they also contracting or the contract will be received first, and then the insurance companies will process the credentialing after.
Amo
So
sa
it's
ting
like they
acting
are happening
kahapon,
simultaneously. So once we receive the
ano,
contract, everything will
kamusta
be
si,
reviewed, the agreement,
ano,
the
si Kay?
payments, fee schedules, and then right
Okay
after
na sila
that,
na
we will
Shlomo.
also be submitting credentialing applications for our providers. So sometimes the
May
effective date
kape
of the
na ha.
contract will be the effective date of the credentialed providers. But that's just it's rare because credentialing has its own timeline, right? So it's credentialing, we have like 30 days, and then we have until 120 days. So even if the facility already has a contract, it doesn't mean that the providers who are within that facility can render services. No, they cannot do that because the contract only applies to the facility itself, not on the services that they are offering. So the contract is only there so that they have an agreement of how much are they getting paid, um, how long the contract would be, what are the inclusions of the contract, benefits of the contract. That's just it. So just like when you signed a contract with ISTA, you have that certain agreement with ISTA. So those agreements should be met in order for the relationship to work. So same with the contracting portion of the skilled nursing facility and the insurance company. But they still have to undergo credentialing in order for them to become in network with the plans. So that's why we are the ones
Eileen,
doing
may isang
credentialing
process map pa
because
akong
we
kulang
are
gagawin ko na.
making sure that the facilities that we handle can render services to these patients, and they will get paid based on the contract rates that has been agreed upon during the contracting process. So it is still important that the facility is getting credentialed and not just getting these contracts in order for them to render services. Okay, so that's mainly the difference of credentialing and contracting. So, but you don't have to worry about contracting because we are only doing credentialing here in guided care. So you just have to focus on that. Okay, so any questions on credentialing and contracting?
None so far.
None for me.
Okay, so next I have credentialing process overview. So here, so earlier we discussed some of the process of credentialing. So here we'll just try to dig deeper on how these processes are, and what's included in here. So step one would be application submission. So application submission, as you can see, it starts here. We're in um, the application needs the following information. So we have the basic facility information, the address, ownership, services provided, NPI, tax ID. I'll show you earlier a sample of what you can see on the database that has this facility information. And then we have copies of current state licenses and operating permits. We also have Medicare or Medicaid certification, proof of liability insurance coverage or the certificate of insurance, the COI. And then we also have accreditation information. Example would be the Joint Commission. So before you submit an application, of course, you have to check all this information if they are available, because if they are not available and then you are doing an application, it's like a waste of time, that you are filling out an application and then you just realize, oh my god, I don't have this, I don't have this information. So you're just stuck, like you're just stuck there. You have already you're already midway your application, then you just realize that, oh, I don't have a current state license. Okay, so what are you gonna do? You'll just stop. You'll be stuck because you have to request the license, and then that's it. So that's why it's important that you check everything first. So ensure that you have all the information, and if not, then you have to request it. I'll give you the templates as well that we use of requesting, and then the what we are doing in case that there are missing information on an application, that you cannot finish an application. So that's part of our training for the next coming days. And then we also have the document verification. So here it pretty much ties up with the application submission, wherein you have to ensure that the documents that you have are current. So there are instances before that it happened to me too. I'm so guilty of it. Um, so I am doing the application, and then I was just new, so I was just doing the application, trying to fill everything that I can, and then when I'm trying to attach the information already, I just realized that, oh my gosh, I don't have this document. So I don't have a copy, of the COI, for example. So it's like I'm also stuck. So I can't do anything. I can't submit the application. I'm not able to verify anything. So it's a really waste of time that I have that I did on those applications, instead of just asking my contractor first, like, hey, do we have this? If not, can we request this? Blah blah blah, and all the other things. So at least I can proceed with another application. You know, but since I didn't do that, I didn't verify the documents. I just proceeded as is. Then I just wasted like 15 to 30 minutes of my time, just doing the application and not being able to submit it. So that's frustrating, but it's okay. It happens, especially if you're new, and you just have to learn from it. So we'll teach you on the different ways on how you can obtain the documents, and also on you'll have most likely you'll have your own workflow, like you'll have your own strategy on how to finish something. So we'll just teach you like what are our best practices, but aside from that, it would still be like your own, like how things will work out for you, like what works for you, and then you'll go from there. If it doesn't work, then Jerry will call you out. So it's going to be your own strategy, but yeah, we'll teach you everything that you need to know, and at the end of the day, it will still be on how it will work for you. And if it doesn't, then you just have to try something else, but we're always here to share the best practices. And then we have review and final decision. So once everything is submitted and all that, so the insurance company will be evaluating this. So reviewing past performances or survey results, evaluating the facility's ability to meet operational and safety standards, assessing compliance with federal and state regulations. So all these are being done by the insurance company. Okay, the review and final decision, this is not ours, this is from the insurance company. So what we just do is to, ensure that in order for them to provide the approval, you have to ensure that all these are followed and are accurately submitted. And then if there is, for example, a denial, then that's because, the accuracy of the document or the application is, it's really not accurate, or it's not, like there are missing documents. For example, you have not attached a document. So there's a document missing. And for SNF facilities, credentialing, attaching all the documents are very, very important. That's why we don't submit an application if we have missing documents, unless it is an instruction from your contractor. So there are exceptions to the rule, of course. There are contractors that they are gonna like take responsibility and say that it's okay. Let's just submit it. And if you have that go signal from your contractor, then you can go ahead and submit those applications even if they lack a document. But if there isn't any um, instruction from your contractor to do that, please, please, please do not submit an application with missing documents. They will just be returned to us as rejection, and the timeline will again reset, and we don't know when it gets processed. So there, so we have to ensure accuracy on that. Okay. Any questions on this?
None?
Then
Good. Okay. And then we have the required documentation. So here, so this section outlines the key documents required for skilled nursing facilities. So these are the here the documents needed. So we have 6 documents needed. This is the standard. Okay. But we also have this. So I prepared this. This is like what we attach on every application. These are the required attachment here in guided care for the application submission. So I'll send this to you as well. And then along with, this websites, we'll go through this too. Um, but yeah, so let's start with the state operating license. So this is the valid operating license issued by the state health department or the relevant state regulatory body authorizing the facility to operate as a skilled nursing facility. So here, we also have the Medicare, Medicaid certification, the CMS survey compliance. I won't really go through, all this because we will be discussing it here, because this is what is being attached. So I'll just go through um, like this quickly. And then we have the CLIA. CLIA is for laboratories. So, of course, since it's a skilled nursing facility, it is required that they have CLIA. So why? Because since those patients are with chronic conditions, they need to be tested for blood, urine, especially if they are having issues, and the doctor requests for a laboratory. So if you are an SNF facility and then you're like or a skilled nursing facility and you have a patient, I mean, it's not recommended that when you get the sample, like you'll give it to another laboratory service outside of your facility. That's something that should be inside the facility itself. That's why it's called a facility. It's not just an area with bed spaces. things like that, but it should have, the laboratory needed to perform the services to the chronically ill patients. And then we have the liability insurance certificate. This is the certificate of insurance to ensure that there's a coverage for its operation and care. And then the W-9 form. So this is a required document as well that you have to attach to ensure that they have a tax classification. So this is for their taxes. So it's a required document. And then we also have the ownership and disclosure information and the managing employees. So this sometimes is optional. It's not really required for guided care to attach this, so it's optional. So here we can go through this one. So this list that I have here are the documents that we will be attaching on every application, like all applications, except of course if it's an online portal application, like for example Etna. Etna is usually online, so we don't attach these applications there. We just attach the W-9 usually, whatever they are requesting. But if it's an application form, like a manual application form that you have to fill out, you have to ensure that you are sending all the applications along with these documents. I don't know if you can see my screen, but let me reshare because, okay. Can you see the word document?
Yes, I can now.
Okay. So here. So these are the required documents attached in an SNF application. So we have, let me see if I can share with the RDP because I don't know if it would work. So I opened my, the invite here outside of my RDP because it's just so slow there. Do you see my RDP? Can I share? Do you see like an email?
Yes.
Yes.
Okay, perfect. So it's sharing. All right. Okay. So here, so we have the required documents in an SNF application. So the first one would be the facility license or operating certificate. So this is a required document, and we have to ensure that this is current. Okay. So if you go to your RDP, you will have your access to the guided care documents. I think this is the one that was shown in Jonathan's screen earlier. I don't know if it was bookmarked or it's something that comes after you log in, but these are the guided care documents. So here, this is where you'll be getting all the documents. Okay, so it is very important that you are careful not to delete anything on this shared drive, shared SharePoint. Okay, so if someone deletes anything, will be will be escalated. So we have to ensure that you are very careful in accessing everything here. So like for example, let me give you an example of a facility license. So when you go to the this is the dashboard, like the main dashboard of the SharePoint. So we have here the facility groups. So we have here the facility groups where the facility is connected with. And then if you click on something, for example, I click Astoria Place, there are other, documents here or other folders here. You will only access facility paperwork. So here on the facility paperwork, you just check the facility that you're assigned. So for example, Cincinnati. So Cincinnati only has W-9 on its folder. What does this mean? So it means that Cincinnati Astoria Place of Cincinnati do not have any documents aside from W-9. So you have to request the documents because there are certain documents that's needed for an application. So this is what I'm talking about, that you have to check this first because you have to ensure that all the documents are here, and you have to get the documents first before you can really finish an application, because here on our list here, a facility license is required. So if there's no facility license, then we cannot submit the application. Is that clear?
Yes.
Okay. So I just want you to, I just want to save you from that hassle of going back and forth, and then we will be like wasting some time. So let me see. Okay, so I can't go back. So I just click home because I can't go back to the first page. Okay. So it's so slow. You have to wait. So yep, Jonathan, you raising your hand?
Yes. I just
Mm-hmm.
have quick questions in regard with the
Yep.
documents that we are going to submit. So, are all the documents needs to be requested, or is there any documents that we can obtain through a certain portal? For example, the
Mm-hmm.
licenses are able to get through some portals with the specific state license. So I'm not. I just wanted to check if all those documents are needed to be requested, or we can get those from, or we can get those by ourselves.
Mm-hmm. Yeah, good question. Yes, there are documents that we can get on our own. That's why before you request those documents, the we have to check first the portals for licenses. For skilled nursing facility, we don't get it from the websites, the state websites. Unlike the individual licenses that you can get the verification. So for facility license or operating certificate, we really need to get like their certificate, the one that's issued by the board or the state. So not like in individual credentialing, you can just get a verification print out from a website, and then you can use that, and then the insurance company will accept it. So for facilities, you can't. So here, facility license, this is um, to be requested. So this is one of the documents that needs to be requested. So we'll go up to the bottom of the list for the ones that we can access. That's why there are some links in here below. So we'll go from there as we go along. Okay. So but for the facility license, this is not something that we can obtain online. We need to request it from the contractor directly. Okay. So let me see if, so I'm trying to look for a sample. I think I know. Okay, arcade. Oh, Aperion. Okay, see. Because there's a lot here that's just new. So if you look, like there's a lot of facilities under one group. So let's see. So here are the sample documents that you have. We have a standard naming convention here, because if you are going to upload, like for example, a document that you got from a website, you have to do the naming convention correctly. So what's the naming convention? Naming convention is usually like this: the name of the facility, and then what is the document name, and then what is the expiration date. It's important to put in the document name and also the expiration date, because um, you'll see here if it's a current if it's a current document. So you don't have to like open it, download it. You can just see here if it's a current document. So of course, it is always necessary to double check. So like, because um there are instances that you can put the incorrect date. So like for example, someone else put this in here. So Sora, for example, put this in here, and then she put in a different date. But when you open it, it's 2024, so it's expired. You know, there is always room for the personal mistakes. So that's why you still need to open it. But looking at just here, you can see that the documents that we have in here are somehow updated. So we see here Oak Brook license expiration for 5/31/2025. So this is an example of a license. So this is the facility license. So if you don't have an a license with the with if you don't have a document that is named as license on this SharePoint on the folder, then you have to request that, since we are not getting this from the portals. So you have to ensure the expiration date is current. So this one will expire 5/31/2025, meaning whoever handles this facility, um, the contractor, most likely they will be requesting for an updated license on this, especially um, if they will be asking us to do an application. So this license may not be accepted by the insurance company anymore because it expires in a month. So make sure that you request this license to your contractors. Okay, so this is an example of a facility license. So the next one is the CMS approval letter or the plan of correction. CMS approval letter or plan of correction, this is from the site visit review. So this B and C CMS survey are related. So CMS survey comes first when it comes to the date, and then CMS approval letter comes after. Anyone who knows why? Based on, like their name or like the type of document, why the CMS survey comes first, date wise, like the date on the document.
It's because the
Any guess?
survey usually comes first and then approval after the survey. I think.
Correct. Survey is what is a survey? Like what do you think is the equal term of a survey for CMS? I think I said this earlier. Do you remember? So
Survey
the
start.
site visit.
Oh yeah, site visit.
Yeah, so the site visit. So the CMS survey is also the site visit. So it's just called the CMS survey. But technically, it's the site visit of CMS to the facility so that they can check if the facility is in compliance with the standards. Um, and then we have the CMS approval letter after the site visit or the plan of correction. So not every time that there's a site visit, the facility gets approved right away. It doesn't happen like that. Most of the time, they get deficiencies. Deficiencies are what they call feedback. So once they get the deficiencies list from CMS, the facility can provide a plan of correction, meaning they will be providing a document stating that this is what we will be doing on the deficiency. So number one, for example, the bed doesn't have a foam. So bed one doesn't have a foam. So plan of correction, we will be putting foam on bed one. So that's a plan of correction. Now, if for example, you don't have any deficiencies, or like your deficiencies are into like a minimum. Like there's not much of like they didn't denote any abuse, they didn't denote any like human rights violation or anything like that, and you'll get an approval letter, then that's good for you, that's good for the facility. But date wise, the CMS survey comes first because this is the site visit, and then CMS approval letter comes after. But on attaching, the CMS approval letter comes first on the attachment, and then the next attachment would be the CMS survey. So I just don't want you to be confused on that. That's why I have put in this document in here, so you would know which are the ones that you have to put in order. And this is something that you'll learn all throughout, like your credentialing experience. Like um there'll come a time that you don't have to like look at the list and you just know what to attach. But date wise, CMS survey comes first, CMS approval letter comes after. Why am I saying this? It's because you have to determine if the CMS approval letter is um a legit document, or if it's the document that we are looking for. So if you go to the RDP here and the documents, so we have here the CMS survey for Oak Brook. It's dated 7/19/2024. So we have to look at the Medicare, the CMS approval letter. So here, so you'll see Oak Brook survey approval letter. So if you click this, you'll see the cycle date. So this is the cycle date, and then this is the survey date, August 21. So they have second revisit certification of 7/9. So the date that you will be checking here would be this one, the date here. So it's August 21, 2024. What's the date of our site survey, the CMS survey? You remember?
Seven
You
nine.
remember the date? Correct.
Seven
So
nine.
is this after the site visit?
Yes.
So is this the document that we're looking for then? This is the CMS approval letter.
Yes.
Correct. So this is the correct approval letter. This is a very common mistake when you start with the credentialing for skilled nursing, because of the documents that's on the drive, and there's a lot of documents in there. And if you don't really like read through it, if you don't know what a CMS approval letter is, if you don't know what a plan of correction is, you'll be lost, and you won't know what to attach. So these questions, you don't have to ask them to your contractors, okay? Because it's a normal question. You can just ask this question to me. You can ask this question to Jerry once she's um when she's fully trained on it as well. But yeah, you can always ask questions if this is like, is this the correct approval letter? Is this the correct CMS survey? Things like that. So the approval letter, we cannot get this from a portal as well. So this one needs to be requested to if it's not available. Okay. But the CMS survey site visit, this one can be um, this one can be accessed through the site of the CMS survey link. So when you go here, this is the CMS survey link. Oh, okay. So we have the CMS survey link, which is this one. So you can bookmark this when I send the document to you. You can bookmark it and then try to look for, some skilled nursing facilities. You can select nursing homes, including rehab services, and then you just have to put in the zip code. So let's try. So let's try 60521. So you just have to put in um, the zip code, and then the nursing homes or the skilled nursing facilities will be here. So what is this? Alter Rehab at Oak. What's the address? 2013. No, we're not in Still Oak Brook. 605. Okay, let's see. So you can also put in the name of the facility, but then it would just, hinder your search sometimes because there are facilities that they are changing their names, so you won't be able to find them. So that's why most of the time we just put in the zip code. So 60521, 60523. Hmm, okay, so it's showing this one. Let me see. So you should be able to see the nursing home that you are trying to get. So I'm not sure if this one changed their name or whatnot. Let me see the ownership. Syrian Care Oakbrook LLC. So the tricky part here is that these facilities, they usually undergo change of ownership, wherein they change their name, they change their tax ID, so they change owners. So that's why it's important that we know what's their old demographic information. So 60523. It's not 60521. So you see that there's difference on the zip code. So if there is this mark, it means that the nursing home has been cited for abuse. Okay. So that's why there's this. It is from the site visit. So that's why it's like that. So we don't want that to happen, but looks like that one. Anyway, this is like, I don't know if we're still working on this, but I think so. So once you get, for example, because I'm thinking this is like closed. Yeah. So it's not here anymore. Oh, here. Alter Rehab. So here. Wrong. So let's click this. So most of the time it the result of your facility will be at the top. I don't know why this one is like here. But you just have to click on the facility name, and then it should work, but it's not. So it's not working. Let me try here on my end if I can like go. So I don't know, 60523 605. Okay, let's see. Can you still see my screen?
Yes.
Can you see my screen? Okay.
Yes. Yes.
Yes.
So let's try Alter Rehab. Oh, so it's really not working. That's good. Okay, let's see. Gonna Okay, there you go. So we have Alta Rehab at Oakbrook. So this is what you can see here. So we have the health inspection, staffing, and quality measures. So you will see the CMS survey here on the health inspection. If you see date of most recent inspection, so this one, 7/19/2024. So the tricky part here is that for the CMS survey, since you can see it here in the website, if there is a recent report that's different from what we have on the folder, then we have to request the CMS approval letter of that most recent site inspection. So here we can see that it's 7/19/2024. So it's good because that's the same, that's the same CMS survey that we have on our folder. And then the approval letter was from August 21, 2024. Then that means that's the latest inspection that they have, and that's the latest approval letter that they have. But if you see here that there is an inspection for example, January 1st, 2025, that means there is a most recent approval letter as well. So we have to request that. Approval letters are valid a year, a year, um, no, actually 2 years. So for inspection or site surveys, they are valid for 2 years. But there are insurances wherein they just want the inspection or the CMS approval within 1 year. So here, this is still valid since it's 2024. So we can still use this and we can still use the approval letter that we see here on our shared drive. Okay. So that's the difference between it's not clear. So that's the difference between the CMS survey and also the CMS survey approval letter. So the naming convention here is if it's a survey approval letter, you have to put CMS survey approval letter. And then for the CMS survey, you can just put in CMS survey or survey. Don't put in survey letter. Okay. You just put in CMS survey. And then the letter should only be on the CMS approval letter so that you won't have a hard time looking for these documents. It's just, it's already named correctly. So that's the second and third document that's needed. So here I put which are the ones to be requested. So site visit can get from the portal. So the portal is here as well below. And then the next is the CLIA certification. So CLIA certification, this is the laboratory certification that they are, they can perform laboratory services. So here we can also get this from the portal. So where is it? So here on our RDP, this is the CLIA that I um, provided you here. So this is the CLIA details for Alta at Oakbrook, and you can see that the expiration date is 6/4/2026. So basically, this is still active. And this document right here was just from the portal. So if you don't have CLIA, you don't have to request it right away. Okay, don't have to request it right away because you can search it from here. So how can you search it from here? You just have to do the CLIA laboratory lookup and then just put in the zip code and then just enter and you will see the list of the facilities with that zip code. You just look for your facility and then you'll see it here. So you just have to, print this and then name it and then you can upload it on the folder. Okay, so this is a very easy way to get your CLIA. However, on some instances, there are CLIAs that's not available here. So if it's not available here, then you have to request it from your contractor because one reason is they have not updated their certification. So if they have not updated their certification, then definitely it will not show into this CLIA portal. Okay, is that clear?
Yes.
And then the next document, uh, 2, 3, 4, 5. The fifth document that you'll be attaching would be the COI, Certificate of Liability Insurance or Certificate of Insurance. So what does this look like? So for the Certificate of Insurance, it looks like this. So we are usually requesting for the face sheet. This is an example of a face sheet. Face sheet is where you can see um, the insured. You can see who is the insurance, which is Great American Insurance. We can also see the policy number, the effective date, and the expiration date. And then you will see as well here, there's like a lot of XXX, blah, blah, blah. So the letters here at the first part, you will see here letter C, B, A, C. This is this one. You will know who is the coverage or the insurer if you'll see the ABC right here. So the first one, the commercial liability insurance, which is an occurrence based, has letter C, meaning this is being handled by underwriters at Lloyd's. So this is the policy number, and then this is the policy effective date. What is important here is for you to look at the personal, the occurrence here. It's here. So you'll see the occurrence here, 1 million, and then you also see the aggregate of 3 million. So 1 million and 3 million are like the minimum amounts that should be on the, occurrence and aggregate portion. So you have to ensure that it has those values, because if not, insurances might not, accept the liability insurance. And then ensure that the policy is effective, the expiration date is still current, it's not expired, and then ensure that there's the policy number in here, and then also this one. So those are the parts of the certificate of liability insurance that you have to ensure that you are checking. So uh, on the application form, we usually have the commercial liability and also the professional liability. These are the most important ones here. So there should be the same general aggregate and occurrence, which is the 3 million for the aggregate and then 1 million for each occurrence. That should be in here. So those are the ones that you should look at. For the certificate of liability insurance, we cannot get this from a portal. So for this, we are requesting it from our contractors. Okay, so I have put in here the ones that you have to check, which are the same parts that I have noted earlier. Okay, and then we have the second to the last would be the NPPS NPI registry, and then the W9. NPPS is just if it's an optional document. It's needed if the application requires it, if the contractors requires it, but usually we don't really put this. Okay. So in order for us to get the NPPES printout, you just have to go to the NPI registry, which I put in the link in here, and then you just have to put the NPI number of the provider, and then same thing, just like what we did with the CLIA, you just need to print it. Okay. So this one, you will not be requesting this, okay, to the contractors. Like never. I don't want anyone to see requesting this document to the contractors. Okay, or I'll kick you. So this one you can just get it anytime. All right. So and it's an optional document. We don't really attach this. And then the last would be the W9. W9 usually is already here unless you have like a very new provider, like a new facility. But usually the W9 is already here. If it's not here, then you'll just have to create your W9. So on the exercise later, I think I have an exercise for you to create a W9. That's why you have to create your own signature. So how do you do that? I think what we did is like we signed on a piece of paper and then we pictured, we took a picture and then we uploaded it on the PDF exchange. So if you need help on setting that up, I can help you on the next coming days. But yeah, that's how you use your signature, because we are putting our signatures on some of the application forms. Okay, since we are the credentialing specialist. So it's us who's signing the application forms and not our contractors, unless they told us that they will be signing it. So just like this W-9, we are the ones who signed this. So the parts would be this one, the legal name. You'll put in the legal name of the, of the facility. And then we have the business name. And then we have the address, which is the remittance address or the billing address. This is not the service location. Okay. This is the billing address. And then we have the tax ID right here. This portion right here, the one with the boxes, if you don't know, don't answer it. The only time that you will know what to put in here is if you have the IRS document, which is a different document that's kind of complicated. I'll maybe show that to you at another time. But yeah, if you don't know, you just have to like leave it. Okay, it's not really something that will be denied if you don't have anything here. Um, so that's usually the part of the W-9, and then you have to ensure that the version that you're using is October 2018. Okay, um, that's the W-9 that's current. If it's 2017, you have to get rid of that W-9 and do a new one. All right. This one, you don't have to request this because you are just the one doing the W-9. You're creating the W-9. Is that clear?
Yes.
Cyrene.
All right.
Hello,
So,
Cyrene.
mhm,
Hi. Sorry to cut you off.
yep.
Do you think it's better for us to take a first 15 minutes break?
No, actually we're about to like end because I have
Oh, okay.
I have an urgent call. So
Oh, okay. Sure, sure,
yeah,
sure.
that's why I'm kind of fast. Sorry.
Sure, sure.
So yeah, so this is the last part. So I'll be sending you some exercises about getting CLIA, getting the documents, getting NPI printouts, and also CMS surveys link. So I will be doing that navigation, and then I'll be sending you an application form, and you have to practice your PDF exchange. So, Jerry and Kim, please let me know if their PDFs are working. Because if not, we have to ensure that with DAS, they'll be giving them the access, like the premium access, because sometimes it's gonna say that they are not like it's not a paid app, like something like that. That's usually what's happening. So if you have issues with your PDF, let me know, because those are the exercises that I'll be giving you. So number one would be the navigation. Most likely we'll start with tomorrow, but for now I'll be giving exercises on the W-9, creating your own W-9, um, getting information for downloading CLIAs from the website, and then also getting CMS surveys, and also rating, the star rating. I believe you've seen the star rating from the CMS portal that I showed earlier. So I'll ask you to do that because that's one task that our contractors are asking sometimes, getting the star rating, and then the NPPES. So those are the tasks or things that you can do for the rest of the day, and then tomorrow we'll have another session with your questions, and then we'll see like if you can already do the navigation, we'll go to the database for tomorrow session.
Got it, Irene. I will.
And then I'll sorry, go ahead.
Oh yeah, I'll be checking the PDF as well for you. For your instructions.
All right. Okay. Thank you. Thank you. Just give me like I think like an hour maybe to for me to get everything, and then yeah.
Sure.
Okay. Right. I think that's it for me. Thank you so much. Thank you so much for your time.